Getting pregnant should be easy, right? Where a man and the woman will have intercourse with each other, and at the end of the cycle, the woman will just test positive. But this is not the case for a lot of trying to conceive couple. I've seen so many people month to month, year to year, they try to have babies and it is proving difficult. So I've put together 5 ways you can improve your chance to get pregnant fast. So if you're trying to conceive, I want you to sit down and watch this video to the end, because I am promising you that you're going to find one thing from this video that will improve your chance to achieve those 2 pink positive lines on your pregnancy test result. Let's dive deep into the video. Now, before I continue, I want you to know that this video is for educational purposes. It doesn't replace the test you've done at the hospital. It is not a medical advice. It is just giving you an education on how you can improve your chance of getting pregnant as you're trying to conceive. Number 1, track your cycle. So many people don't know whether they have a regular cycle, a fluctuating cycle, or an irregular cycle. And this is really important for you as you're trying to conceive. Your cycle can be regular, where you have a predictable cycle. Maybe month to month, you have a 28-day cycle, or 29 or 30-day cycle. For some people, their cycle fluctuates, where they have a cycle that can be different, 2 to 3 days, 4 days, 5 days, which is also considered fine. In that kind of a cycle, it is also predictable, and it is easier for you to predict when ovulation is possibly going to happen and have timed intercourse and obviously get pregnant if everything is okay. And then we have irregular cycle, where, the cycle is not predictable. This month it is 21 days, the next month it is 40. That kind of a cycle length is not considered normal. And if you have that kind of a cycle length, it makes tracking when you are fertile a little bit difficult and can delay conception. It is important you know this as you're trying to conceive. Number 2, regular intimacy. What I see some trying to conceive do is they try to track intercourse or time intercourse. Now, it is good that you time intercourse as you're trying to conceive, because obviously you cannot get pregnant all the days of your cycle. But some of you are doing it the wrong way. You just wait for only ovulation day, and that is the only time you have intimacy with your partner. The recommendation is at least 3 to 4 times a week. And if you cannot achieve 3 to 4 times intimacy with your partner as you're trying to conceive, you look out for your fertile window. And that brings me to number 3. Know your fertile window. Your fertile window is the time surrounding ovulation. Ovulation is the release of mature egg from your ovary, and within this time you can get pregnant. The reason why fertile window will work is because the man's sperm lasts about 3 to 5 days in the female reproductive system. Now imagine having intercourse with your partner 3 to 5 days before your ovulation. Even if the man is not anywhere near you during the ovulation or on the ovulation day, you still have a very good chance to achieve positive pregnancy test. I'll make another video explaining everything you need to know about your fertile window, and it is important that once I drop that video, you go and watch it. Now let's move over to number 4, which is understanding male-related fertility issues. Now, whenever I talk about fertility or whenever I talk to clients, I would find out that the women are the ones who usually go to fertility clinics or even go to the doctor to figure out the reason why they've not gotten pregnant. And I understand one of the reasons is societal pressure. Most times, the pressure of trying to conceive comes more to the women than it comes to the men. And sometimes the men just feel that they don't have fertility issues just because they are able to perform good in the bedroom. But let me tell you this, you can be perfect in the bedroom and still find it difficult to impregnate your partner because you could have issues with your sperm. And which other way can you confirm whether you are healthy as the man, as the 50% in this trying to conceive journey, if not for going to the hospital, doing a test to figure out if everything is okay with you? So as a man, if you've not gone for any fertility test, you are doing yourself and your partner a disservice. You are making the trying to conceive journey difficult for both of you. Now, if you've watched this video to this point, it means you love what I'm doing here, and possibly you're trying to conceive and you're looking for possible ways to improve your chance to get pregnant. I have helped a lot of couples to get that positive test. And these are some positive pregnancy tests to prove that. So this is the right place for you to be in. Click that subscription button right now and also turn on your notification. Like this video as well so that it can be pushed to other couples who are trying their best to achieve positive pregnancy tests. Now I'm going to tell you the last but not the least, which is visiting the hospital. Who should visit the hospital? When should you visit the hospital, and why should you visit the hospital? As a trying to conceive couple, everything could look okay on the outside. Signs and symptom wise, your cycle is regular, you have a normal period, you ovulate, and yet you're not getting pregnant. The man looks healthy, the man is wonderful in the bedroom, yet pregnancy is not happening. Now, this is where a professional help comes in. Your doctor is there to help you professionally to figure out possible reasons why you are not getting pregnant and also offer you professional help. Sometimes the help you need is just a little medication here and there, or a little surgical procedure here and there, or science-based assisted reproductive technology, which can make you a mother or a father faster than you even imagined it. So if you don't go to the hospital, how can you get this help? So I am advising you, as a trying to conceive, it is important for you to go to the hospital to figure out what the problem is. Now, this is the recommendation. 1 year for couples who are less than 35 years of age and those who don't have any known fertility challenge. If you have any known fertility challenge, you don't have to wait. And also, if you're above 35, you are recommended to try for at least 6 months before you start going for a hospital visit. But like I said earlier, if you have a known fertility challenge, you do not have to wait at all. You can easily go to the hospital, talk to your doctor about your fertility issues. Now, for those who have had children, this is also for you. You cannot say, oh, because I've had children before, I am going to wait eternity. If you want that second baby, you want that third baby, and it is difficult, it is important that you go and see whether there is anything hindering you from achieving a positive pregnancy test. If you've watched this video to this point, I love you, and I want to tell you that I'll constantly come here to educate you all on how to improve your chance to get pregnant faster. I am still your Wongo Nation president, and I will see you all in my next video.